Hello everyone. Today our topic of discussion is sepsis and septic shock. Now sepsis, we all know this is a type of medical emergency and we have to give the treatment at the earliest. Okay. Now see, what is the definition of sepsis? Sepsis means that is actually a response of the host cell because of any sort of pathogen entering into the body. You know that pathogens, like they can be bacteria and all, viruses and all, so when they're entering inside your body, then they actually release certain chemicals. They are the pathogen molecules are released, and those molecules will bind to the innate immune cells like the macrophages, and in the macrophages and all we have the PRR, pattern recognition receptors. So in these receptors, like the toll-like receptors are there, then there is the RIG1-like receptors, NOD1-like receptors, C-type lectin receptors. So in these receptors, basically the most important, remember, is the toll-like receptor 4, on which these PAMPs will bind, and when they will bind, they will actually form inflammasome. And this inflammasome will actually release tissue necrotic factor alpha, interleukin 1, and as we all know, the cytokines are basically released during inflammation and they will produce inflammatory response. So this response will be so severe that could lead to multi-organ failure. Certain organs, their dysfunction will happen, like the cardiovascular, like the respiratory, neural system, they will actually get hampered. Because remember that whenever there is this type of conditions, there can be oxidative stress, there can be mitochondrial dysfunction, and automatically what will happen, there will be less production of ATP. So automatically you can understand that all these things will be hampered in together way. There will be increase in the microvascular permeability. So all these things will happen. Even the PMLL, that is the polymorphonuclear leukocytes, they will also produce response, and all these things together will start affecting the body, and it can be so severe. This is a case of medical emergency. Okay, remember that when even nitric oxide will be released, and that will actually cause vasomotor collapse. So these things are basically related under the pathogenesis of the sepsis. Now what is septic shock? Septic shock means the sepsis will be there, and also remember there will be cases of hypotension. Okay, there will be hypotension. So you have to elevate, you have to give vasopressor drugs to elevate the blood pressure. Mean arterial blood pressure will be elevated above 65 mmHg, and you should maintain the serum lactate concentration above 2 millimole per liter. So these two criteria have to be followed. Then only we can say that yes, if it is not followed, then the patient is in septic shock. Okay, so it's clear what is sepsis and what is septic shock. Now talking about the etiology or the causes. Mainly you remember that infection due to any pathogen, like there can be pneumonia. Pneumonia is the most common infection which can lead to sepsis, and that is caused by 2 gram-positive organisms. It can be Staphylococcus aureus, and it also can be Streptococcus pneumoniae. Another, there can be gram-negative organisms also, like E. coli, then Klebsiella species, then we have the Pseudomonas. So they can actually cause different other infections in the intra-abdominal and in the genitourinary tract. In these regions there can be infections which can lead to sepsis. Now remember that we have studied the pathogenesis. Now talking about the clinical manifestation. In clinical manifestation, remember there will be chances of acute respiratory distress where there can be hypoxemia, and we follow the Berlin's criteria where we say that if the partial pressure of oxygen is falling below 100 mmHg, then there is actually severe sepsis. Also, in cases of acute kidney infection, it is seen that in more than 50% patients with acute kidney infections, there are higher chances of sepsis. And remember the features, like there can be high levels of serum creatinine, there can be oligouria, in which you can understand. See, there is no proper diagnostic, golden standard diagnostic criteria for sepsis. There is no such thing, but we have to check like that, such that we can get confirmed that yes, there are chances of sepsis. Because see, it is not suddenly happening. There will be an infection that will stay in your body for minimum 5 to 7 days, and then they will produce, means the body will produce such a response that the patient will actually get into a state of coma. There can be, yes, the patient of sepsis can actually go to coma, and it can also lead to death. So as I've told you, this will hamper the cardiovascular, the neural system, and also respiratory system, and other systems will be also affected. Remember that in EEG, electroencephalogram, we actually get non-focal encephalopathy. We actually detect that, and that is one of the criteria for somewhat we can diagnose that there can be chances of sepsis. Okay, so these things I believe it's clear. Now talking about the most important thing, that is how we will diagnose the disease. First, remember, we have to check the vitals, like if there is tachycardia, if there is hypotension, if there is tachypnea, if there is hypoxia, leukocytosis, or at times there can be leukopenia also. Metabolic acidosis will be there with high anion gap. So these are certain points. Now see, these can happen in other diseases also, right? So what we actually do, we actually have to send the particular sample for culturing, and before we actually administer the antimicrobial drugs. But see, it's a case of emergency, so of course you'll have to send this, the culture will occur, and then they will get the lab results and all, so it will be time consuming. So by those certain cardinal signs, we have to understand that the patient is in sepsis, and then we will actually start the antimicrobial therapy, which is very very important. When we are doing this, before that we have to send for the culture, and then the reports will come and all. It can be due to pseudomonas also, staphylococcus, as I've already mentioned. So mainly we rely on the antimicrobial drugs, and you should be first confirmed that the kidney function test is proper, because we just cannot directly give the antimicrobial drugs, because we have to use cephalosporins in this case, so we cannot give it directly. So remember what we do, we actually first check the kidney function. Other function tests have to be done immediately, as early as possible, so that we can start the basic antimicrobial therapy. Other than that, certain adjuncts can also be given, like we have the hydrocortisone, which can be given, at times it is given, but we have to check for the certain cases that where they can't be given. We have to first rule out those things, and then only we can apply the antimicrobial drugs and also the certain adjuncts necessary, right? Now let's focus on thing, that is how we will give it. Like the adjuncts, as I have told you, high dose of intravenous ascorbic acid, or we actually combine it with thiamine and all, and then we actually give the drug. Now talking about in sepsis or in septic shock, we follow certain regimen of drugs that we actually give. Like we can actually give the cefamine. Cefamine, you can check the dosage that I have written over there. 2 grams of given every 8 hours. Okay, so we can administer cefamine. Certain persons can actually be allergic to the beta-lactam antibiotics. So for them, we actually give ciprofloxacin and also levofloxacin, which can be given as per the dosage. Like ciprofloxacin 400 mg per, it will be given every 12 hours, and levofloxacin 750 mg every 24 hours they have to be given. Those basic criteria they have to be maintained and given. At times vancomycin, that is also given, where the loading dose, you see that it starts from 25 to 30 mg per kg body weight, and then we shift to 15 to 20 milligram per kg body weight, and that is administered every 8 to 12 hours. Okay. Now, as I've told you, there can be hematological problems also, hematological disorders also in this case. If we see there are neutropenia, that means the neutrophil count has gone below 500 per microliter, then we actually administer certain drugs. One of the most important is the cefamine, that is given again, because remember 2-3 drugs which are most important. And other than that, we can also give in severe sepsis with tobramycin, vancomycin and caspofungin. Their combination, these 3 drugs are combined, and alternately these are given. Their dosage are fixed. Okay. In cases of splenectomy also, if there is the person has undergone splenectomy, then we actually have to give certain drugs like the ceftriaxone. Okay. Ceftriaxone is actually given again 2 grams every 24 hours. Okay, so that drug is very important that we have to remember. And in cases of meningitis, if there are chances of meningitis, then that dosage is actually given 2 grams only, but it is given every 12 hours. Remember this. Now see, if there is any sort of cephalosporin resistance, like there, so in that case you will see the pneumococcus level is high, so we actually add vancomycin to that. Or if there is chances of allergy to vancomycin, that can be given, that time we actually shift to levofloxacin. Okay, so that drug has to be, so remember these 3-4 drugs. One is the cefamine, one is the ceftriaxone, and one is the levofloxacin. Okay, so these drugs are very important, that has to be, that those drugs have to be given properly. And also, as I've told you, certain intravenous hydrocortisone, these are actually given as adjuncts. Okay, so that was sepsis, but sepsis more we will study in details. But that was the overall idea of sepsis. That is, this is sepsis, and this can be so fatal. Okay, because the patient can go to coma and eventually death, or there could be cardiac failure also. Remember, in HIV infection, in cases of cancer also, there are higher chances of sepsis, because as you know, in HIV already the body is infected with the pathogen. Okay, and then automatically the response can be at times so dangerous and so vigorous that the body can go, actually there can be chances of sepsis and septic shock. Okay, so you have to check those vital signs, that tachycardia is happening, then there is hypotension and all. So these parameters have to be checked continuously, so that you can give the correct drug properly at times, and also you can follow other protocols of treatment. Okay, so that was septic shock. Thank you.